Welcome to Gracefully Graying. I am your host, Attorney Henry Gornvine. Today on Gracefully Graying, I am very pleased to welcome as my guest, therapist Andrea Verier, as she leads us on the topic of understanding ambiguous loss. Andrea, welcome to Gracefully Graying.
Thank you. I'm glad to be here with you, Henry.
Well, it's a pleasure having you. First of all, why don't you tell our viewers a little bit about who you are and your background?
Okay. Well, I'm originally a Michigander, but lived most of my adult life in Florida, and I'm back in Michigan again now. So I'm a licensed mental health counselor in Florida, and in Michigan, it's called a licensed professional counselor. So that just means that I am trained to do psychotherapy with all kinds of people and have done it with all kinds of people of different ages and backgrounds for the last 30 years.
You specialize in any particular area in your practice, and if so, tell us about it.
Okay, so for a long time, I really did specialize in adolescence and eating disorders and all the other basic things that you would think of, anxiety, depression, go along with that. But as I aged up, my clients, many of them have aged up, and I find myself working with 50-year-olds who are concerned with their parents or grandparents and older adults, going 65 and up, who are going through various issues having to do with aging. So I decided to really specialize. And for the last 2 years, I've been adding to my education, studying dementia and working with the Center for Mental Health and Aging, which is Dr. Regina Kopp, and becoming a gerotherapist. So I am now a clinical geriatric mental health specialist.
Which is very important with our aging population. I mean, a lot of people are now in the sandwich generation with children and aging parents. And our country is aging, our state is aging. I mean, our average ages are in their over 55. So it is an important area that you're in. First of all, why don't you describe for our viewers what is meant, Andrea, by the term ambiguous loss?
So it's kind of what you would think, but it's like you wake up in the morning and just not knowing whether to grieve or hope, not knowing whether to use the word is or was, not knowing whether to set the table for two or one. The idea behind it is that it's one of the most painful kinds of losses because the person is still alive. Nobody has died. That is the basic understanding or definition of ambiguous loss, is that, the person is still there. However, life feels very, very different. And there are all different kinds of ways that somebody, when they die, we get acknowledged, we get casseroles at the doorstep, we have funerals, we have rituals, cultural script that is inherent in normal kinds of loss. But in ambiguous loss, the person is pretty much often experiencing it alone.
Andrea, tell us about the different types of ambiguous loss.
Okay, so, the two main things are that there could be a person who is physically absent, but psychologically present. So an example of that would be like a missing in action military person. You're thinking of them every day, but you don't know where they are. And the big example of that is, the Samantha Guthrie story that's been in the news. So in that situation, it's very, very public, so everybody knows about it, which isn't typical in this type of loss. But, their thought is, we will not rest till we find our mother. Well, weeks go on, she's present in their thoughts, and they still haven't found her. So this is a very poignant example of ambiguous loss. But it also could be other things, like an estranged child, which, by the way, is a trend. We have more and more estrangements of young adults from their parents, or a disappeared parent, or an incarcerated family member. You don't have the physical presence of the person in your midst, but psychologically you're thinking about them.
These are important distinctions. Are you seeing more and more people estranged from family members?
Unfortunately, yes. It started for me, about 2 years ago. I was getting one case after another where there would be an estranged family member, often a young adult, and their parents. And it's exceedingly painful because oftentimes they do not tell the parent why, and they cut off communication entirely. So when there's no communication, no contact, it's sometimes called, one of the areas where this term is used a lot is in the field of estrangement between family members.
Are there any common threads among some of these estrangements?
Well, so some of it is believed, obvious, the real things everyone could understand would be if there had been horrible abuse in the family, or there had been, family secrets or lies that came out, and then, the adult children just didn't want anything to do with the mess, But often it's much more subtle than that. Some of the studies talk about this generation of people around in their 30s who are less community based and more individualistic in their thinking, and they are less connected to a family centered life and more connected to me and mine and my life and my husband or my wife or my whereabouts, and haven't found a way to communicate well with the problems from the past and still become an adult that's independent of their parents.
Andrea, how can micro losses pile up?
Well, micro losses, you'll see those more with the second type of ambiguous loss. And that's psychological absence, but the person is physically present. So this is a loss that you see more often with caregivers of people with dementia, for example. That's a really big example. Because every day things chip away. Things that let's say it's your partner, things you both shared, things you both remember, your sense of humor, inside jokes, nicknames. The person is there, but their self is somewhere else.
Sure.
And it might happen so gradually. It could happen over 10 years, or it could happen suddenly. And it's just, to be very dramatic, it's like that horrible saying, death by 1,000 cuts. You feel each and every little change. Oh, you used to love this dish. Oh, that doesn't taste good to you anymore. It could be something minor or something really major, like not remembering that you're the person's spouse.
And we're seeing more and more cases of dementia too, as our
Yeah.
population ages. What is the value of naming these types of losses, and I guess with regard to micro losses, or expound on it?
Ambiguous losses. It's really important because if it goes unnamed, it's unaddressed, and it goes underground. So psychologically, then, you might have years of bearing this almost a shameful feeling, like, how could I complain when my best friend's wife or husband died and mine is still here. And am I allowed to express grief when my partner has dementia or, some other change? It's not always dementia. It could be you have someone who after retirement started to abuse alcohol and they're like not home every night. They're there physically, but they're not present. There are lots of ways this could be, but by naming it, we validate what the person is experiencing and that they are not imagining these feelings. They are crying because they are grieving. They feel isolated because they have a type of loss that no one named, and maybe they feel very misunderstood. And so, naming it is very significant. It kind of says, I hear you, I see you, I get what you're going through, and I'm here with you as you're going through it.
So by putting a label on it, it helps you deal with it, actually.
Yeah, for sure.
Andrea, tell us about pre-death grief.
Okay, so, if we know that somebody has a terminal illness, not that doctors can predict the, precise day that something's going to happen, but we might be, let's talk about anticipatory grief first, because that's really, we're anticipating something that's going to happen. We know there's an endpoint, and we're aiming to sustain our caregiving or our connection and know that there's a cutoff point. But pre-death grief is a little bit different because we don't really know when the death is or if there's a death. I mean, the death could be 10 years from now. We just don't really know. And I think that's more of the type that people feel who are caring for someone with dementia. It's the person's clearly not dead. Nobody said. I mean, if they have Alzheimer's, different, there are various types of dementia. Sometimes there are some real cues as to what the, progression might be. But with other types of dementia, that isn't the case. You don't know. For instance, Parkinson's dementia or frontal temporal lobe dementia. Nobody's going to be able to tell you exactly when this is stage 1, 2, 3, 4, 5, so you're grieving before there's been any death whatsoever.
Makes sense. I mean, you've lost a person, perhaps physically, perhaps mentally, and you're grieving that person, but that person may be around for months or even years. So
yes, exactly. And so it doesn't get the same understanding, and there might even be some shame that people feel because it's the underlying thing that's organizing your emotional life. And your children might not understand, or they might be going through it as well. Let's say if it's a spouse. Or it could be any kind of mental illness, actually, that, somebody who, let's say, is suicidal and has chronic depression over many, many years. And you feel as though you can't connect with them. They no longer want to go do things with you. They sometimes call you and they say they've had it and they want to end it. And they may have had hospitalizations, but then they're still there. And so it's not always dementia, but it's so clear for those who are experiencing caregiving directly for dementia, how these things play out.
So basically what you're saying, I mean, to capsulize, it's like death has finality, but with these diseases, there may not be an end point for some period of time. So there is no finality. So you're kind of in a suspended stage.
Yes. And, we don't do a great job with grief, death, and dying in our society, I don't think anyways. But there are cultural norms that go with it. you know. There could be a celebration in one culture, there could be, you know, weeks of mourning in another. But there are rituals, there are things to do. And actually, in the early stages of a death, people are involved in all of those things. And then maybe there's an aftermath when all that quiets down. Um, the thing about the ambiguous loss is that if it goes unnamed and if it goes underground and depression sets in the individual who's going through it, when the person does die that, you know, one has taken care of, people think that person should feel relieved. But if they haven't been able to acknowledge the grief all those years, instead they might just have a mountain of grief that comes at the end and really hits them unexpectedly. And it doesn't fit a cultural norm again, because it's like, oh, you must be so relieved because you've been caring for this person for so long. And yet it's no, I just noticed how much grief is in me that I never talked about.
What about ambiguous loss versus anticipatory grief?
Well, you know, again, same kind of thing with anticipatory grief. We talked about it a little bit already, you know. But I guess the main distinction would be, again, the known endpoint versus an unknown endpoint, and how it affects you psychologically. So people will often say, well, I'm prepared for this loss because I've known it's been coming for a long time. But they're not really prepared. The moment of loss is the moment of loss, you know. But they're prepared in the sense that their community's prepared, people will come and surround them, and so on and so forth. But the ambiguous loss has both in a way. It has the part nobody knows about, and then suddenly everybody knows about it. So you're having to straddle those experiences when it finally comes down to it. And it's a lot to handle.
As a therapist, how can you help someone going through this?
So, you know, the main point with therapy is people want resolution. You know, so for example, if somebody has an estrangement and they say, you know, we've been meeting for a number of weeks and you've been really by my side, you've really been giving me support, but I just want my son back. You know, I cannot resolve that for them or with them. So we're not aiming for resolution because that's not in the person's hands.
Right.
And there are some specific things you can do with estrangement. You know, there's some books that you can read and follow their direction on how to handle that. But oftentimes it just, nothing happens. You don't even get a response. So, and with caregiving, similarly, you can't resolve it. You can't say, I'll make your person okay. You know, I'll make your person remember you. So with therapy, instead, we're looking for things like finding meaning. You know, how do you find meaning? Helping your client find meaning in a situation that defies an easy explanation. Mastering your own sense of agency, where it remains possible, even when so much just feels out of control. That's something we work on. Your own identity, helping the person, and I've worked on this with people, reconstruct their identity. Who are they in this relationship that had defined them? For instance, a mother and a son or a husband and a wife is fundamentally altered. Who are you after that? Who were you before that? And then sort of the complex feelings people might have working with their ambivalence about, you know, how ambiguous loss, it has love and grief. And how do you live with both of those things? Devotion or resentment, you know, or relief or shame. It depends on the person and the type of relationship they have had. Working on their attachment with that person, that the person they are losing is neither frozen in the past um, from cutting off, but adapting to the things that you did have with them in the past as memories, uh, and then trying to create some hope, cultivating some realistic hope. You don't, I never say to people, oh, I know it will turn out okay. Your son will call you, or I know that your husband tomorrow night will remember you, and you'll sit and talk about your wedding day and what that was like. We don't make any promises, but we have hope about what there can be in the future. Um, and just letting people know that grief and love can coexist. You don't have to choose one over the other.
It sounds like a lot of it deals with acceptance.
Yes, yes, that's a good word for it, because when you ask somebody, how are you going to build a life worth living in the midst of grief and sorrow and uncertainty, you when you live next to something, there's a level of acceptance, and the word is mistaken often to mean that you approve of what's happening or you're in favor of what's happening, but that's not it. It's allowing it to be part of your reality, acknowledging it, and living beside it rather than stuck in the middle of it.
I'm circling back to your example of Savannah Guthrie and the loss of her mother, and the fact that I'm sure she's dead, but it's still unknown. So,
Right.
what does therapy do for someone like that?
Well, it's a long-term thing. I mean, I have worked with some military people who had, uh, you know, fellow Marines who went missing in the Vietnam War. There was quite a bit of that. And it's a very prolonged kind of grief. And that kind of takes us in another direction too, because that can often, in that situation, move into survivor's guilt. Like, why did he get captured and I didn't? Is he dead? Is he alive? Are they torturing? Yeah, you could really, and what you really want to do is get the person living in the present more so, trying to find each day something about that present day of value and meaning, because staying in the past too far, or in some cases, like with the caregiving, getting way ahead of yourself, is not helpful.
Andrea, what do you find most rewarding about your practice?
Well, it's been great to work with a variety of people, because I learn so much from the people I see. I learn everything from things about their professional life, about their, religious background or their cultural background. And I enjoy the feedback that I get for being a person-centered therapist. In other words, it's not the formality of the therapy that is important. It's the connection between the therapist and the client. And that is a very sacred connection, in the sense that people often share their absolutely most private and vulnerable things. And being witness to that is a privilege and an opportunity to help that person get through something very, very challenging.
I can see how you relate well to people. Andrea, what about frustrations?
Frustrations are plentiful along the way, especially at the beginning of forming a private practice. For years, I worked with every single insurance company there was, and needing a staff of like 5 people to handle all of that. And then, some clerical person saying, well, this problem should take 10 sessions, and they really don't know anything about the person other than the diagnosis that you have to give them. And I did that for many, many years. I don't do that now because I have a little more freedom. I have a kind of a more boutique-ish practice where it's just me. I don't have a secretary. I don't have anybody helping me. It's if you text me, it's me. If you call me, it's me. That gets rid of some of the frustrations for me. It also does make accessibility to therapy more difficult for many people. I reckon that's a frustration too. But those decisions along the way, you get to the point where you're a senior therapist and you got to change the way you do things. I work less than I used to. Sometimes I used to work too much, and my husband used to tell me, "You're working too much. You're tired. You're too tired." And I was. I worked 5 and 6 days a week. Now I work 2 or 3 days a week.
It's a matter of striking a balance.
Yeah.
What are some final thoughts you can share with our viewers before we sign off, Andrea?
Well, a few things that come to mind. I mean, first of all, the fact that you have this podcast is just amazing to me. I mean, there are so many topics related to aging. And I am not a fan of the term anti-aging in any sense of the word. I think aging is a privilege. I don't think aging is an illness. I don't think grieving is an illness. I think they are normal parts of life that have specific challenges, more so or less for various people. And the other thing I would say is with regard to grief, whether it would be ambiguous loss or any kind of grief. I once heard this phrase and it really struck home with me. It's the solitary work that cannot be done alone.
Well said. What can I say? It's a matter of, as we're aging and I'm up there, it's a matter of embracing it. And, our tagline for Gracefully Graying is living life fully. And I think that's something that we all have to do to the best of our ability. So, Andrea Verier, I want to thank you so much for being our guest on Gracefully Graying today. I want to thank our viewers, of course, for watching Gracefully Graying, and of course, Bloomfield Cable and our sponsors for making Gracefully Graying possible. Thank you again. Andrea, thank you so much. This was
Oh, you're so welcome. It's my pleasure.